So I understand that the service is actually quite slammed, and I'm kind of worried about you guys. How are you doing?
We are really under pressure, and the mahi just keeps coming in, and we have an amazing team within the Access team who really, every person that's referred in is looked at as an individual. You know, we are human. Most of us have got our own kids, and we appreciate that this is about this person's child. We may have the huge volume of, referrals per year, but that's insignificant to that family whānau. This is about their child, and we understand that. We understand that this is so important to them that we take a lot of time to actually really look at that referral and really work it up as much as possible from the perspective of what's going on for that young person and the family whānau. So we know from research from in December in 2023 there was the Royal Australian New Zealand College of Psychiatry quoted that in the last 4 or 5 years there's been a 50% increase within specialist mental health services referral rate, and that is definitely the case within our service, the Waitaha Canterbury Specialist Mental Health Service CAF situation. We're really under pressure, and due to that we have, it takes a long time for us to see people, which is really stressful for families and that young person. And again, we know that it would be so fabulous if we could get the person in really quickly and see them, but we just can't do it because things get worse. But we're, like we said earlier on, if things do get worse and parents have questions, if the person's been referred in, there is a whole process that goes on if we accept that referral and the person goes to an outpatient team. There's contact from that outpatient team every 3 months. If anything gets really stressful in that time, they can contact that team or contact us, the emergency function of our team, or the crisis resolution team after ours. So we're really, really aware that there's just this huge, it's been like an explosion, and we have no idea why that is. And it's really hard for young kids and their family to be going through this stuff.
And for you trying to staff at an adequate level.
Yeah.
With so many more numbers coming through.
Yeah. It's great when you've got a really fantastic bunch of people that really care about what they're doing and have really got that. We're really patients, that we call them patients, but they're not. We've really got that young person at the heart of what we're doing.
Because it's about their future.
Yeah.
If we don't offer them now, then they're just going to become another statistic. We don't want that.
And the detrimental effect that not having the right treatment or the right care, or us directing that person to go to an NGO that we know will hopefully support that, what's going on for them. The sooner you get onto that and the sooner that starts happening, the better outcome for that young person.